So it's been a year since I've had my gallbladder surgery, and ever since then it's just been a wreck. I had mine August 2016. Right now we're in August 2017. And let's talk about the surgery first. Surgery went fine in the sense where they got the gallbladder out. Gallbladder came out fine, but they couldn't get into the bile duct. And so the surgery was supposed to be 2 hours, took 4 hours. And so after manipulating everything, basically tearing me up, uh, they couldn't get into the bile duct, so they gave up. They kept me in the hospital for a couple days just to make sure that, my bile duct, like there wasn't bile leaking or if there were stones left, and make sure that they weren't bothering me or anything. And so afterwards, the recovery took probably about 3 months until I was fully recovered, until I actually felt comfortable to ride my motorcycle. And it sucked. I couldn't even sit up. I had to have my boyfriend help me sit up for like the first month just because it hurt so bad. And it may make me sound like a wuss, but it really did hurt. And so as the year has gone on, I've just been in pain still, and where my gallbladder used to be, and around my belly button area. And I just thought, like, how can I still be in pain when the thing is gone? But so since May, I've been to the ER, a handful of times. Trying to figure out what's going on. They've been sending me home and it's like, hey, your blood tests are coming back fine. Everything's fine. We can't find anything wrong with you. They even did CAT scan and MRI and said, nope, there's nothing. Until finally one of the doctors, who I guess, saw how many times I was there, and she was like, no, go see a general surgeon. Maybe it's scar tissue or something. So I went finally to meet the general surgeon, and the first thing he says when I walk in the door is like, you have a hernia. And it's called an umbilical hernia, and it's mostly caused from abdominal surgeries. So I'm guessing it was caused from my gallbladder surgery. And so they just did that last week, and I'm still recovering right now. But compared to the gallbladder to this, the pain does not even, it's crazy. Does not even compare. But it feels so much better. Like, I still have points right now where, I have pain and I feel nauseous and stuff, but I'm not taking the pain medicine like I guess I should. I hate pain medications and stuff. But, so, yeah, that's been my life after gallbladder surgery, a year after surgery. But, so, if you're having gallbladder surgery, unless it's about to explode, like mine was, I had the opportunity to change my diet and stuff, before I actually had the surgery. But, I just can't stay away from carne asada, and that was what caused me to have my emergency surgery, because the gallbladder was so inflamed. But yeah, if you can, just change your diet, just do some research before you actually commit to having this surgery. Try to change diet, take supplements, do all that. And yeah, I just really suggest to try to change it. I mean, I know other people's experiences have been a lot better after they gotten their gallbladder taken out. But after mine, I suggest to try more natural things to try to stop the pain and just try to make you feel better. Yeah, just don't get it out. I mean, I know people too who was supposed to get theirs out, and they just changed their diet, and they just feel completely better, and they've lost weight, and they just look good. So, so that's my advice on my gallbladder and what happened, why I do not suggest to have any surgeries for it. So take care. Bye.